Welcome to the grand finale of Inside Melatonin. I'm your host, Gaganasri, a systems biology and computational biology enthusiast. And today we are wrapping up our 20-part journey with a big picture look at melatonin's potential. In this episode, titled Melatonin Synthesizing Insights and Future Horizons, we'll reflect on its role in immunity, metabolism, and brain health and explore what's next for this remarkable molecule, especially in post viral recovery like long COVID. Joining us is Prachi Virat, a microbiology genius with a bachelor's and master's, eager to dive into a PhD focused on the dynamic interplay of microbiomes and bioinformatics. Welcome back, Prachi.
Thank you, Gaganasri. I'm thrilled to wrap up the series and look ahead.
It's been a fantastic ride with you. Let's dive into our first big question. What are the key takeaways from our exploration of melatonin's roles across immunity, metabolism, and neurological health?
Melatonin is a multifaceted molecule with far reaching effects. In immunity, it modulates inflammatory responses by downregulating pro inflammatory cytokine like IL 6 and enhancing antioxidant defenses, which is critical in conditions like COVID 19. As we speak, metabolically, it enhances insulin sensitivity by upregulation of GLUT4 transporters and protect pancreatic beta cells, aligning metabolic processes with circadian rhythm. Neurologically, melatonin crosses the blood brain barrier to reduce neuroinflammation, supporting mitochondrial function and promote neurogenesis through BDNF upregulation. These actions position melatonin as a potential therapeutic adjunct in long COVID, addressing immune dysregulation, metabolic imbalance, and cognitive symptoms like brain fog.
Let me break that down. Melatonin is like a Swiss Army knife, tackling inflammation like a firefighter dousing flames, fine tuning metabolism like a conductor syncing an orchestra, and clearing brain fog like a janitor sweeping away neural clutter. It's a versatile tool for the body's recovery toolkit. Here's a follow up question. Could melatonin's ability to act across these systems make it a unique candidate for integrative treatments in complex conditions like long COVID?
That's a great perspective. Melatonin's pleiotropic effects, its ability to influence multiple physiological systems simultaneously, making it uniquely suited for integrated approaches. In long COVID, where patients face overlapping immune, metabolic, and neurological challenges, melatonin's capability to address inflammation, circadian misalignment, and neuronal stress could complement other therapies like antivirals or physical rehabilitation, potentially enhancing overall recovery. Its low toxicity further support its use in multimodal treatment plans, though we need more data to optimize its role.
A Swiss Army knife that plays well with others. That's promising. Now, next question. What are the challenges in translating melatonin's research potential into clinical practice for post viral syndromes?
Translating melatonin's research into clinical practices faces several hurdles. First one being optimal dosing and timing remain unclear. Studies use dosing from zero point 0.5 to 40 mg per day, but standardized protocols for long COVID are lacking. Secondly, variability in individual responses driven by genetic differences in melatonin metabolism by enzymes like CYP1A2 complicates dosing strategies. Third one being long term safety data for high dose regimes are limited, particularly for chronic conditions. And finally, integrating melatonin with other therapies require trials to assess interaction and synergistic effects. These challenges highlight the need for rigorous clinical studies to establish evidence based guidelines.
So it's like trying to navigate a ship through uncharted waters. Melatonin has potential, but we need clearer map for dosing, timing, and safety. Let's dive into a deeper question. Could personalized medicine like genetic testing for metabolic differences help overcome these challenges in using melatonin effectively?
That's an insightful angle. Personalized medicine could indeed be a game changer. Genetic testing for polymorphism in CYP1 A2, or other metabolic enzymes could predict how individuals process melatonin, allowing tailored dosing to maximizing efficacy and minimizing side effects. Additionally, biomarkers like circadian rhythm profile or inflammatory markers could guide timing and dose adjustment in long COVID patients. Such approaches could bridge the gap between research and practice, making melatonin a more precise tool, though implementing it at a scale requires accessible testing and standardized protocols.
Personalized navigation for our melatonin ship. That's exciting. Now, another question: what future research directions could unlock melatonin's full potential in post viral recovery and beyond?
Future research could focus on several key areas. First, large scale randomized controlled trial are needed to determine optimal dosing, timing, and duration for long COVID and other post viral syndromes. Second, studies should explore melatonin's interactions with existing therapies like anti inflammatory or neurorehabilitative interventions to identify synergistic effects. Third, investigating genetic and metabolic predictors of response could personalize treatment. Finally, exploring melatonin's role in emerging areas like mitochondrial repair or vascular health could broaden its application beyond post viral syndromes to conditions like neurodegenerative or metabolic disorders. These directions could transform melatonin from sleep aid to cornerstone of integrative medicine.
So, melatonin's like an explorer standing at the edge of a vast frontier, with new lands like long COVID recovery and beyond waiting to be mapped. One last question: could discoveries in melatonin's role post viral syndrome sparked by breakthroughs in understanding other chronic illnesses with similar mechanisms?
Absolutely. Long COVID share mechanisms like chronic inflammation, mitochondrial dysfunction, and autonomic dysregulation, with conditions like chronic fatigue syndrome, fibromyalgia, or even Alzheimer's. Insights from melatonin's effect on these pathways in long COVID could reveal therapeutic strategies for these and other illnesses. For example, its role in mitochondrial repair could inform treatment for fatigue dominant disorders, while its neuroprotection could apply to neurodegenerative diseases. This cross pollination of research could redefine melatonin's place in medicine.
That's a thrilling vision for melatonin's future. Thank you so much, Prachi, for guiding us through the final chapter of melatonin's vast potential.
My pleasure, Gaganasri. Thank you for having me.
That wraps up our episode 20 and our last episode of Inside Melatonin series. We have seen melatonin as a Swiss Army knife, a ship navigating uncharted waters, and an explorer of new therapeutic frontiers. Thanks for joining us on this journey. We'll see you next time.